Hello, my name is Emma Smith and my NSU ID number is N021699945. And before I get started, I would just like to say thank you so much to the admissions committee for selecting me to complete this video interview. I'm extremely honored and excited to continue my journey with NSU Tampa Bay's OTD program. So the first question I was asked is, why do you want to become an occupational therapist, and how did you first become aware of or interested in OT? So when reflecting back on my childhood, I can think of a very specific instance that led me to the medical field and knowing that I wanted a profession in the medical field. So both of my siblings when I was younger were diagnosed with brain tumors. And although this was extremely difficult, it was an extremely difficult scenario and situation to grow up in, I was able to find the silver lining, and that was realizing that I needed to help people for a living. It wasn't until high school, however, when I specifically became aware of occupational therapy. And I was extremely lucky to have two of some of my favorite people in the whole world be occupational therapists. So I was able to ask as many questions as I wanted, judgment-free, just about what their average day in their life looked like or what type of practice settings they liked the most, just various questions like that. And after that sparked my initial interest, I began to research a little bit more. And after my research, it began to click that I love helping people, I love being independent, and I would love to help people be their most independent selves. So that's really specifically what drew me to OT. And then when researching even more, I was able to see how much variability there is in OT and how many different avenues you can take in the profession, which I thought was super unique. And this sort of variability was very attractive to me, in that I never want to be bored in my profession. I would always like to have the opportunity to pursue different paths in my career if able. So occupational therapy seemed like a great option for me. So the second question that I was asked is, in your view, how is occupational therapy different from physical therapy? And I believe that there are a multitude of reasons why the two are very different, but I would say that the main difference that I have seen is that occupational therapy is much more patient-specific and individualized. Through my observation hours, I have seen how each treatment plan is developed and customized specifically to the patient's needs, wants, and goals. And I believe that this creates a much more personal relationship between the therapist and their patients. The second aspect that I believe is very different between occupational therapy and physical therapy is that occupational therapy is much more focused on cognition than physical therapy. And I found this extremely interesting to me. Being a psychology major and having that background, I'm very interested in the cognitive aspect of OT, such as just teaching attention and concentration tactics, assessing visual perception and processing, or aiding in planning and organization techniques. I've seen these be really helpful and effective in therapy, and through occupational therapy, I would love to see how this cognitive aspect comes into play. So the third question that I was asked is, why do you want to get a doctoral degree when the current entry-level requirement is a master's degree? So obtaining my doctoral degree in occupational therapy opposed to my master's would greatly widen the range of career opportunities that I'm given, and I truly believe that it would help me meet all of my future career goals in this field. Policy making is an aspect of the doctoral degree that I have shown a great deal of interest in, and I would love to pursue in my career at some point. Ever since I found out exactly what OT was, I became very interested in advocating for the field as a whole. Through my observation experiences, I've seen areas of certain practice settings that I would wish to advocate for. And a very specific example of this was seen when I was observing in a skilled nursing facility this summer. I was able to see the frustration between the OTs and their patients in this facility, and just the challenges that came with the ever-changing healthcare system and the limitations that it put on the recovery plans for the patients based off of insurance holds or other various issues. I would love the opportunity provided by the doctoral program to advocate for a positive change in these healthcare systems. And I love that the doctoral degree provides an opportunity that focuses on the bettering of the profession as a whole. So the next question that I was asked is, where do you see yourself 10 years from now? How do you see the NSU OTD program as helping you achieve these goals? So 10 years from now, I will be working as a practicing OT in a skilled nursing facility. I will be gaining experience that will help me become a leader in the practice of OT in the very near future. And eventually, I will have a position that allows me to influence public policy decisions. I believe that I will be able to be an advocate with all of my previous knowledge from my patients' past experiences. And my overall goal will be to provide a more inclusive society for diverse populations with various occupational needs. I believe that NOVA would help me achieve this goal because their mission directly aligns with all of my goals and values. Their program has produced graduates who are leaders in the field of occupational therapy and have gone to succeed in various different avenues of OT. I believe that NOVA's flexibility in the OTD program would allow me to seek outside sources that will help me be better prepared for my professional experience as a whole in the future. So the next question that I was asked is, what do you know about NSU Tampa Bay's entry-level doctorate program? What are your reasons for wanting to attend this program versus other programs? So some of the things that stood out to me about NOVA Tampa Bay's program was the accreditation status and how it was one of the very first OTD programs to gain its accreditation. This is extremely important to me in that I wish to start practicing immediately after graduation, and I would not want to have to wait to sit in on my NBCOT exam. I also really love how NOVA's program is only a 3-year program. It's focused on getting its graduates prepared to practice much quicker. And that being said, even though it is a quicker, more fast-paced program, it still does have a 98% NBCOT pass rate, which is extremely impressive. The next aspect that I really enjoy about NOVA's program is how the faculty and professors are leaders in the field of OT. A lot of the faculty has seen to be keynote speakers, consultants, and even published authors. I find this very inspiring, and I know that I would learn a great deal of information from them as leaders and role models. I also really appreciate NOVA's dedication to having a small class size. I am attending a very large university right now with around 40,000 students, so I've seen the effects that a large class size can have. I've seen that it's much less engaging, it's difficult to concentrate, and I believe that there's a less personal connection with professors. I believe that NOVA's small classroom size would better prepare me for real-world experience and give me personal connections with professors that would give me a more enriching graduate school experience. So the next question that I was asked is to describe why cultural diversity and subsequently cultural competence is an important consideration in the field of occupational therapy. So I believe that occupational therapy is rooted in expanding opportunity for diverse populations. With this comes the importance to show empathy and understanding for people that are different from you. I really enjoy NOVA's focus on expanding the diversity of their program and the impact that it can have on the field of OT as a whole. So it's very obvious and apparent that occupational therapy from a first glance is not the most diverse profession. With NOVA offering a blended option for its doctoral program, I believe that it's welcoming students from all over the world who have experienced all different walks of life to come together and collaborate. Their combination of ideas and values contribute to the betterment of the field, and it would be something that I would be extremely proud to be a part of and be excited to experience a multitude of different opinions and perspectives. The next question is a scenario-based question, and it states, after taking a very hard exam, you find out that several of your classmates got a copy of the exam ahead of time and did very well. The rest of the class failed the exam, including you. The instructor informs the class that she will not curve the exam because of the students who did so well. What would you do? So if I were presented with this scenario, I would have to tell my instructor. I believe that I would not only be doing a disservice to myself, who studied very hard for the exam, and believe that my grade should affect my efforts. I would also be doing a disservice to my classmates who also studied, because what if they didn't know that the exam was compromised and they began to have a lack in confidence of their abilities, which can be very damaging. And I also would be doing a disservice by not telling my instructor to my classmates who found the copy of the exam. This shows that they're not educated in the material and they risk not performing well on their patients in the future. The next question is also a scenario-based question, and it states, you are working in an outpatient clinic and a client of yours who has had hand surgery is not making good progress. Her surgeon has a poor reputation in the clinic. One day, the client says to you, I don't feel I am getting any better. Was my surgeon any good? What do you consider in attempting to resolve this ethical dilemma, and what would you say or do? So the first thing that I would do in this scenario is to make sure to express empathy and concern for my patient. I would be able to make them feel validated and make them feel like their problem is being heard. This is extremely important, and I believe it's where the therapist portion of occupational therapy comes into play. I would then offer to schedule a meeting with myself, my patient, and the surgeon. In this meeting, I'd be an advocate for the patient and use my medical knowledge to try to reach a solution between myself and the surgeon. And then I would also adjust the treatment that I am giving her to make her seem like she is being challenged in some way that will instill progress in her recovery. I believe that it's very important to never talk poorly about your colleagues to your patient or anyone, for a matter of fact. Just it comes off extremely unprofessional and it can create an extremely uncomfortable work environment. So the next question that I was asked is to describe my strengths and identify areas in which I need to grow. So I would say that one of my main strengths is that I'm very empathetic. I enjoy helping and understanding and relating to others. I feel like this would help me create strong connections with my patients in the future. I also am very hardworking and persistent. I don't like to quickly give up on a task. I will keep it up and try and find a solution if available. I also am a great collaborator in group settings. I love to hear various opinions and perspectives from my peers and come together to create an amazing solution. And lastly, I would say that one of my main strengths is problem solving. I love to observe conflicts, analyze conflict, and find a solution that can be helpful to a wide variety of people. So some of the areas I believe that I could grow in are dealing with my stubbornness. I often find it hard to forget about failures and move on. I sometimes get caught up in one way of doing things, and it's difficult for me to change my way of thinking and accept that that might not be the most efficient and find a more efficient way. Lastly, I would say that I like to stay in my area of comfortability. Some of my most enriching experiences have been when I've stepped out of my box, but it's often difficult for me to take that leap to step out of my box. So I would say that those are just a few of my weaknesses. So the last question that I was asked is, there are a number of applicants waiting to be interviewed. Why should we take you? So I am a leader at heart. I am extremely motivated and ready to work hard in any graduate school that I attend. I will be an advocate for my patients and the field of occupational therapy as a whole. And I believe that with NSU Tampa Bay's OTD program's help, I can create policy changes that will make our society more inclusive to individuals with various occupational needs.